Australian hospitals are already seeing major strains on their resources as they're inundated with worried Australians wanting to be tested for the virus. Now, as the spread continues, concern is turning to how the system will cope with severe cases that front to our intensive care units. New guidelines by the Australian and New Zealand Intensive Care Society are now recommending that hospital staff use their discretion when admitting ICU patients and only take those who have a likely chance of survival. Joining me now is Sue Dunlevy. She's the National Health Reporter for News Limited newspapers from Canberra, and she's been covering the coronavirus crisis with regular updates. Sue, I want to start at the top of the show. This is the first time you've been on. Thank you very much. I have read you for many years as a health policy analyst in the newspapers. You're one of the best in the business. So I read with interest the story you had today about these new guidelines. Tell us what they are and give me a sense of how enforceable they are.
Well, I don't think they're saying that from today that elderly people and people with chronic illnesses might not be admitted to ICU. They're forecasting what will happen as the coronavirus gets worse and the hospital system is overwhelmed. So we've got 2,200 ICU beds in public hospitals around the country at present, and on one estimate of what could happen under this virus, we would need 650,000 ICU beds over a year. That's if half the population gets infected. And we'd need 2 million other hospital beds. We've actually got 95,000. So this gets to the crux of why this is an important virus, why we can't treat it like the flu. Even though 80% of people will probably have it very mildly, they may not even know they've got it. It's the 20% who are going to get a severe illness that are going to overwhelm the hospital system. Many of the people who get it severely will be elderly, or they'll have other health conditions like heart disease, diabetes, high blood pressure, respiratory problems, or cancer, for example. And those are the people that are more at risk. So we've seen the Society of Intensive Care Specialists issue some guidelines about what's going to happen if the virus spreads far more widely in the community. And one of the items in that new set of guidelines is that if more than 50% of the nation's hospital beds are full up with coronavirus patients, then there won't be enough ICU beds and you're going to have to ration them. And the decisions that you're going to have to make are pretty similar to the decisions that they were making in Italy when their health system got overwhelmed. You're going to have to decide that patients who are the least likely to survive should have the lowest priority for accessing the few ICU beds that we do have. So that could mean that I think in Italy they said if you were aged over the age of 80, those people 20% of people over the age of 80 will die from the coronavirus if they get it, according to the data that came out of over 55,000 cases in China. So they would be given low priority access, and as would people with other conditions like diabetes and heart disease, because physicians would imagine that they would have less chance of survival. So the few ICU beds that were available would have to go to younger people who were more likely to survive the disease. So they're very tough decisions for doctors to have to make, but these guidelines are preparing them for that. Now, the nation's pandemic health plan also mentions that this is an eventuality. If the virus gets worse, that we'd have to ration access to the few hospital beds available. And I think Professor Raina McIntyre from the University of New South Wales says that all pandemics and emergency health situations have a kind of like a traffic light system, and that applies. And so if you see a mass of patients in an emergency and you can't deal with all of them, you would basically not treat the people who you thought had the least chance of surviving and focus your resources on those who had the greatest chance of survival.
So it's interesting, you know, gosh, it would have been probably 2 weeks ago I started talking about ventilators because at the start of the year my mum was on one. She'd had an abdominal operation, and so, you know, it focused my mind how critical ventilators are for people in intensive care and coming out of major surgery. Interestingly, then when I went looking and got your number of around 2,000 beds in Australia, I looked around the world. You know, we've got 2,200 in Australia. The United Kingdom's got 5,000. So for every one Australian, we've got, for every one ventilator, there's about 12,000 Australians. In Britain, it's much worse statistics, obviously higher population. In the United States, about 160,000 ventilators, so that's one for every 2,000 Americans. In Germany, 25,000. We've got just over 2,000. Germans have got 25,000 ventilators. That's one for every 3,000 Germans. The issue here, of course, is there's not many made per annum, and they're mainly made overseas. Am I right, Sue? And with so much of this equipment, we know face masks, sanitisers and other things, we don't have a market here in Australia to produce them at home.
Well, that is one of the risks that this virus epidemic has exposed, that we are reliant on everything from our most commonly used medicines to things like ventilators on overseas suppliers, also for these tests, just the tests for coronavirus. Now, luckily in Australia, we have been able to, at institutes like the Doherty Institute, develop our own coronavirus tests, but we're already facing a shortage of some medicines even before the coronavirus happened because we rely on overseas supplies. And I think that this should focus the mind of our politicians on coming up with some local manufacturers. About 7 years ago, the head of GlaxoSmithKline came to Australia and offered the Australian government the opportunity to buy into one of the factories they were about to close, to leave it there in case we had a situation like this where we needed to rapidly produce some vital drugs like antibiotics, and the government refused to take up that offer. It's looking pretty silly now given the situation that we're in, and we should definitely re-examine this right now, and definitely after this virus is
I know
cleared.
Greg Hunt... So I know Greg Hunt has had defence personnel or defence procurement companies involved in manufacturing some of these things. Before we go, there's been some debate about the use of ibuprofen. Can you just help us out before we go to the break? What's the latest advice for people who might be symptomatic?
Yeah, so there's been some initial discussion out of a Lancet article that there could be some problems if you use ibuprofen and you've got the coronavirus. And it's not just ibuprofen, it could also extend to things like aspirin and some of the commonly used arthritis medications, because what happens is that the coronavirus somehow impacts on your lungs and forces the production of this enzyme that raises your blood pressure. Now, drugs like ibuprofen and aspirin can also do that, so then you kind of have a double whammy on your blood pressure. That's the theory anyway. We're still waiting for final medical evidence, but in the meantime, I've spoken to pain specialists, and the NHS in the in the UK and the French health system are advising people, if you get coronavirus, please don't use ibuprofen, go for Panadol to reduce your fever. And pain specialists in Australia are urging Australians who may be taking these arthritis medications, don't stop them now, but if you do get sick with coronavirus, you might want to speak to your doctor about trying to find some other way of dealing with your arthritis until you clear the virus.
Okay, that's good advice. Sue Dunlevy, thank you very much for your time.